Okay, so here's our patient we were talking about. She's going to cleanse her finger. Now she's going to do a little needle stick like a patient would do if they were a diabetic and checking their glucose with a monitor. She's going to get some blood from her finger and drop it on the well.
Maybe if I can grab it.
Okay, good.
It's not. Just bleeding everywhere.
Okay.
Just not getting in there.
Okay, there we go. We're going to put our 2 drops of buffer. And now we're going to wait to see a reaction on the paper. And as you can see, the paper is starting to turn dark because by osmosis, the combination of the blood and the buffer is moving up the paper, which has been impregnated with the COVID-19 antigens that are specifically made for this one device, but aren't necessarily uniform for all of them. And we give it 15 minutes for the final result. And what we're looking for is that we should see either a line across the IgG, a line across the IgM, or both. And here's the control. In other words, that control is going to be positive. Now we're reaching the control portion. Right there. And so far we have no line, so we're going to wait. Now keep in mind, this is a patient who had symptoms, had a PCR nasopharyngeal test by a national laboratory that was positive detected, which means that we're going to assume that this patient truly was infected, either very low symptoms, but infected. And this antibody test should prove positive if we're going to believe that going to any of these offices where these rapid tests are being used and not necessarily have been vetted by the FDA or proven to be accurate, this should be accurate. You can see the control is turning darker, as it should, meaning the test is functioning. Now we need to see if the IgG or the IgM turns positive. So we can wait.